start the afternoon session with a discussion about the Oliver McGowan draft code back to consultation. And to lead this discussion, I'd like to welcome Hazel Griffiths, another of our fellow experts with lived experience, Trevor Wright. Alongside them is Eleanor Howat, who is a policy manager in the Learning Disabilities and Autism team at the Department of Health and Social Care. So I'm going to just look at that.
Hi everyone, I'm Eleanor Howat, and I'll be talking a bit about the Oliver McGowan Code of Practice. And I've been lucky enough to work on Oliver's training for about 3 years now, and most recently on the Code of Practice. So as has been mentioned already today, a new requirement came into law last year that all health and care providers who are registered by the CQC need to make sure that their staff have learning disability and autism training. The law also says that the government must provide a code of practice about this legal requirement. And a code of practice is a set of guidelines for how an organisation or a service should work. And it gives guidance about how they can meet the law. We've worked with different people and organisations to co-produce a code of practice, including Hazel and Trevor and lots of other people in the room. Next slide. So what does the draft code of practice say? It explains what the law is on learning disability and autism training, and it also talks about Oliver's story and why training is so important to make a positive culture change. It also explains that Oliver's training is the preferred and recommended package to help providers meet the law. The code of practice sets out 4 standards or rules for learning disability and autism training, and the rules are based on learning from the trial of Oliver's training. The code also talks about how it should be used by health and social care providers and how often the code will be reviewed or looked at in the future. Next slide. So we're currently running a consultation on the draft code of practice. The consultation opened on the 27th of June and it closes on the 19th of September. And we're really interested to hear from different people to help us improve the code when it's ready to be published. And anyone can respond to the consultation by completing an online survey. And in the hallway there's also some plain English materials which explain about the code, including the content of the code. And an easy read will be available soon. But if you do have any questions about the code today, you can come and ask me. Slide. So as I said, if you want to respond to the consultation, you can find it on the government website, and this is also where you can read the draft code of practice. So what happens after the consultation? Well, once the consultation is closed, people at the Department of Health and Social Care will look at all of the consultation responses and decide if any changes are needed to the code. The final draft must be shared with MPs in Parliament, and they'll have a chance to ask questions before the final code of practice is published and available for everyone to use. And then after 5 years or sooner, the government will also check to see how the code is working and to see if any changes are needed. I'll now hand over to Hazel to share her experiences.
Thanks everybody. I kind of coming on it from the code isn't just for providers and that, it actually provides information to the general public and actually people who access regulated services in order to help them to help the general public and people with experience understand how much training staff should have. And it's really important we complete the code of practice consultation so we hear your wishes and thoughts and not just organisations. It's really important to have that voice. I think what sets Oliver McGowan Mandatory, I say Oliver's training now, I'm really sorry, Oliver's training, apart from other training for me, it's all being co-produced. You know, it's the core principle of Oliver's training. And Oliver's training clearly demonstrates the standard the government expects in the training, so why would we use any other training, in my view, in my personal view? And and it helps, the code of practice will help providers meet the new legal requirements. So it's really important for me we make the code very strong, and actually you know, for me, delivering training face-to-face, co-facilitating, delivering is the most enriching experience I've ever had. You can bounce off each other, you can ask questions, you get a feel of it, you get that emotion, you get that good feeling of when someone's in that room. The other two things that I really want to do is, because we're doing all this good work, but unfortunately we do need CQC regulations, so the code will help the regulators. They'll give that guidance to help providers you know, deliver really good high standard training. And I think they are changing the inspections, the CQC, they have to. You can't just turn up and produce a PDF at the end of it. It has to be ongoing, and there has to be lots of developmental support, not going with a police hat on, but actually support our providers as well. The other thing that I want to see is NHS contracts or contracts with social care. That's another way that we can make sure that providers deliver high quality care and training. Thank you very much.
Thanks to Claire and Eleanor for the invitation to speak, and for Tom and Paula for getting us here. I was a social worker and commissioner for 30 odd years, and actually diagnosed when I was in that role. And as often happens, my daughter was soon diagnosed a couple of years later. So I've sat in professional meetings where people have been talking about the autism pathway is really good in that we've got. All our staff know a lot about autism, thinking, not so sure. When you come in contact with reality, what you think you know, and it's happened to all of us, what you think you know isn't always what you know. So I've been a big supporter of Oliver's training, been involved since the trials, and I think there were two things that I noticed on the trials. First of all was, after a while, the ability of professionals to actually drop preconceptions and start to engage and start to think about how reasonable adjustment in their role, in their environment, could actually work. And that to me is a big benefit. The other benefit is actually seeing people with lived experience stand up and be trainers, not just speakers who come in for 10 minutes and then get to one side again, but who can hold a room and who can facilitate. I worked with one young man who's 19 who, by the third time he'd stood in front of the people, he was actually doing some of the bits better than me, and I've been doing it for quite a while. Lots of benefits. The code, I think, provides a framework for this. So in 3 areas. First one is holding health and social care providers to account. None of this, we're too important to do the training. None of this, we've already done it, we've already got our own. The code should corral health and social care providers. The second thing, I think, is providing some quality standards for training providers. Again, some providers are starting to kind of get involved. There's lots of good ones, but I think what we don't want to see is those providers that are doing health and safety on Monday, moving hand in on Tuesday, Oliver McGowan Wednesday, blah, 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 who aren't connected to autistic communities, and who aren't connected to autistic research, and so are not up to date. So the code again hopefully gives a standard of quality. And my last one is really protection for those people with lived experience, both in fair levels of remuneration, but also in the support that people with lived experience need before, during and after facilitating training. So those 3 areas I'm hoping that the code provides, as Hazel said, she's vanished, as Hazel said, a strong, really strong framework by which we can hold people to account. I would like to make a plea for the involvement of those people with a learning disability and autistic
thank you, Trevor, Hazel and Eleanor. So just to summarise, you can see how you can get involved in the consultation. Thank you, Hazel. I know Hazel's got a dash for train. Thank you. So you can see how you can get involved. I just want to remind people that Oliver's training has informed and set the standards that you will see in the code. So as Hazel said, why would you do anything else? It's there for you to use. It's delivered in a consistent way, it's co-delivered, and it has been co-developed. Trevor, I like the challenge, and I want to say a huge thank you to Trevor and Hazel, and Sean and Anna and others who really held us to account for developing the code. It took longer, I think, than any of us anticipated, Eleanor's nodding, to get to the draft that's for consultation. That's because people, with lived experience, people, in this room kept saying that that doesn't make sense, or you haven't thought about that. So thank you for those voices, keep them coming to us, and do get involved in the consultation. So I'm going to hand over to Sean now, please, and Sean's going to introduce our next speaker. Thank you, Sean.
Thank you for the interesting discussion on the code of practice. If you would like to read more about the code of practice, there's a plain English information you can take home with you. If you don't mind asking, whereabouts is there? So I can
Just in the hallway, or
Just
just
in the
outside the door. Yeah.
Right. They're just outside in the hallway. We're now going to hear from another area on how the NHS is rolling out Oliver's training. I'd like to welcome Paula Gilluley, Chief Medical Officer in the NHS for North East London.
Thank you for that wonderful introduction, and extremely well done. You said my name properly, which is unusual, because usually I get Gilluley, whatever. Yeah, my name is Dr. Paul Gilluley. I'm a consultant forensic psychiatrist and Chief Medical Officer at NHS North East London, which is one of the new ICSs. Thank you firstly to Paula and to Philippa for inviting me along today to speak. I'm not going to go into a huge amount of detail about the North East London rollout. I'm going to talk much more about the support for the actual training itself and where I'm coming from as Executive Director in the new ICSs and what we can do to make this really happen. So as I mentioned, I'm Chief Medical Officer. I'm one of 3 Chief Medical Officers out of the 42 ICSs that has a mental health background. So really important for us with a mental health background to keep mental health and learning disability on the agenda in the new ICSs. Too often we get caught up a lot with the acutes, too often we get caught up with the primary health care, but actually to keep mental health in that agenda the whole time is really, really important. One of the major roles of the ICS is to address inequalities in access, experience and outcomes in health. A really shocking report was issued by the Race and Health Observatory recently, which stated the average age of death for people with a learning disability who are from an ethnic background is 34 years of age. That is shameful. That is really, really shocking. And coming from an area where we have a huge diversity in our local residents, we have a real need to provide them with good quality services. So Oliver McGowan Training provides us with a tool to help us address these inequalities and to give our learning disability and residents with an autistic disorder a real quality service that they deserve. A big personal thank you to Paula, to Tom, to Philippa, and all your time and effort you have given to get things to this stage. I cannot think how much time and actually pushing you've had to do, how many doors you've knocked, how many people you've had to plead with to get to this stage. It is a real magnificent actual thing you've done and really important for our local residents. Today celebrates is an example of what you've achieved so far, and you should be justifiably be extremely proud. Now, Philippa will know through personal experience that North East London certainly has had a couple of challenges in the last year at getting this off the blocks. That's required a bit of unsticking by myself, and I think we're now in the right direction to go in and to move in to roll out this training. All our 5 providers will be using the Oliver McGowan training as their chosen way of training. So we've got a huge amount catching up to do, but I'm sure we will do that. We always do. We've a paper going to our board to actually lay out how we're going to do that, how we're going to achieve that over the next year. In the famous words of the Vice President of the United States, Kamala Harris, we can and we will do this. It's not just we can and we will do it, it's we have to do this. We have to do this, not just because it's mandatory. We have to do this, not just in memory of Oliver and what that actually stands for, his legacy. We have to do this not just for Tom and Paula and Philippa, but we really have to do this for our local residents, for our communities with people with a learning disability and with autistic spectrum disorder. They deserve much better, and they are not receiving the level of care they should get. This will start to give us something that at least their voice can be heard. And we need to, at all times, remember to advocate for our communities such that their voice can be heard. So please, 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 I'm talking to the convention here, to support the training. You're showing that you've supported the training, you're showing what you've actually achieved so far, but please don't give up the fight. Keep fighting and keep going and make sure this becomes a reality. Thank you.
Thanks, Paul. What's the now there? We'll now hear from NHS England about their vision for what it will be for all of us training in the next few years. I'm pleased to introduce Claire Murdoch, National Mental Health Director for NHS England, and Emma Clark, Lived Experience Policy Officer co-worker for the Learning Disability and Autism team.
Hi everyone, I'm a little nervous, so I'm going to try not to talk fast, which I normally do. So where do I start? So my name is Emma Clark and I am a policy officer for the Learning Disability and Autism programme, but I'm also autistic myself, and I have an autistic daughter who wasn't diagnosed until she was in crisis and then sent to a non-autism training at BTU. So I'd say the last 8 years have been pretty hard for us, to say the least, but it was through her being diagnosed that I was. And if professionals, education, if people have known about autism, how it presents in girls, I might have been diagnosed earlier, my daughter might have been diagnosed earlier because I couldn't see anything wrong because we are very alike, and then at 15 she wouldn't have been sent away for her first time away from home. She was restrained 70 times in 7 months because the ATU was non-autism trained. The second one she was sent to was, she was restrained once and they realised and they worked, and then we got her home 6 months later. So that's the difference autism and Oliver's training can do to real people. So I know you are all on board, but I want you to shout from the rooftops. I want you to really explain, because we nearly lost our daughter many times over those years, and we're still fighting to not get autism taken off her diagnosis. So I'm really pleased to be here to talk today. So a few things which make a difference just to start with. I have got a long list, if you want to speak to me, of things I want in the future and for now. But for me and my family, I hope Oliver's training will help staff to better understand how to support autistic people. For example, will help them to really listen to what we are saying. This will allow us to open up about what we are experiencing and feeling, and in turn get better care. Will will understand, although we may look like we are totally fine, we can be really struggling inside. How many times have I heard, oh, you don't look autistic? Okay. We will learn to allow longer appointments or quieter areas. This will help us to attend services and not avoid getting help or getting there and being too overwhelmed to function. But also this will help as well with getting screening. I personally haven't had a screening for about 10 years, and if my daughter needed something, I would take her, because I would do that. But to do it for myself without reasonable adjustments is horrendous, so I'd rather put up with the uncertainty than actually have a screening. And there is cancer in my family, my mum, my aunt, and so on. We'll understand that meltdowns, shutdowns and difficult behaviour is not bad behaviour, but that living in a neurotypical world without adjustments can be overwhelming. We'll make adjustments in employment to be able to access and apply for jobs. Simple things like having interview questions in advance, application forms in easy read or plain English, or allowing flexible hours is a first step. So I work part-time, I do 18 hours, so I normally work Monday, Tuesday, have Wednesday off, work Thursday, Friday, have the weekend off. Sometimes I work extra days, and then I need a few days just to self-regulate. Otherwise, I'm a bit scatty. When I applied for NHS England, I applied for a couple of jobs. One of them, it was just a standard NHS application form. It took me 3.5 days to fill it in, and I didn't get an interview because I'd missed one word that they were looking for, which was impatience. This job, they had the application form in easy read. I did it in 45 minutes, applied, and I got the job. So those simple, thank you. So those simple adjustments just make it that bit easier, you know, to understand and interview questions as well. Please be specific about it. Don't expect to hear a word that you haven't said that you want to hear, because I'm not going to say it. So to change the culture that sees autistic people and people with a learning disability as less than others, but instead we are people that have potential. I will hand you over to Claire.
That was lovely. Good afternoon, everyone. It's such a privilege and a pleasure to be here. I do feel an overwhelming need to say sorry for my footwear. I usually wear smarter shoes, but I've got a bad knee, so forgive me that. I just want to say passion isn't enough. So everyone here in this room cares a great deal, almost by definition, that you've made time today to be here. I know, and I've heard other speakers saying it too, we're speaking with the converted, that you're people that care a great deal. I think it's our role at NHS England to make sure that we're very business-like about, have we got the money? Have we got the people? Is there a clear mandate? Are they really clear what we're asking them to do? Can we count it? Can we see if they are? If they're struggling to roll this training out, for example, do we understand why? And are we supporting them? And this has to be really, really clear. It's a business plan. And from that, we can deliver, I believe, the things that we care most about. Paul Gilluley, one of my favourite doctors in the entire NHS, and lovely to see. I haven't seen you in person for years. But as you have said, we're in a position right now of transition. So some parts of the country have been doing nothing in this space around training and awareness in what autistic people or young people might need, or those with a learning disability. They've had very minimal training. Others have set up their own training and they're proud of it, and we now need to work with them over the coming year and two, and I know, Pippa, we've talked about this, to transition them to Oliver's training. Now, I don't just work at NHS England and think about the money and can we count it and what's the performance management and how do we know and what's the consequence if people don't, which is different from supporting those who make mistakes. I'm also a mum. I'm a mother. I've got 2 sons. And my youngest son properly left home at the weekend to a little flat in Kentish Town, so there was lots of tears. But I do want to say as one mum to another, and another, and no doubt many other mums here, but particularly Paula to you, I think about you often. I think about the loss of beautiful Oliver. Boy, he was good looking. I'd love to know who's good was. I'm teasing you, Tom. That was me teasing you. No, his dad's pretty good looking as well. Very bad of it. I can see you there, Tom. But I just think he was a beautiful boy. And everything we do is about loved, unique human beings. They're part of families, they're in our hearts, they are loved. And Paula and Tom, I don't know how I worry about you sometimes because you have to live in a place of determination but so often pain. But you've so determinedly used your experience with Oliver to make a reality of this training that didn't exist in a few months ago, really, or certainly years ago. Pilots, yes, but as a national thing, in statute, in law. And your pain and your beautiful boy is absolutely, and all the other beautiful boys and girls and young men and young women and older men and older women whose lives have been needlessly lost, have to be the engine room for what we do. But as I say, I think particularly if you work in the NHS, passion's not enough. Words are easy. Moments like this will open our hearts, but we've got to be super smart, super smart. And I love, Paul, you saying that now everyone across your ICS is going to do the Oliver McGowan training. And you almost had sort of steel in your jaw when you said that. And I can only imagine what some of the conversations might have been, because we're in a period of transition. We know why we're doing this, so I'm going to stop really quickly because I did say to Emma, take longer because your voice is more important than mine. But we absolutely do need people to have the skills to feel comfortable asking the right questions, treating everyone as unique individuals. If they don't know, speak to the carers, loved ones, family members, ask. We want people to have the skills, we want them to have the longer appointments. Emma, I'm ever so tempted to start nagging you about adjustment and how we help you, but that's for offline later. You can see the other things that we want to, what we're looking for in the future, I don't know. We want better access. The premature mortality figures are a disgrace, but do you know what? They've been a disgrace for a long time. We have to see the dial moving on better health outcomes. It's not just enough to do the physical health checks, brilliant that we have. We've had some great successes, but checks in and of themselves are not enough. It's what follows them. We want better quality of care and earlier diagnosis. It's not okay, but it's too often that young people are first diagnosed at a point of crisis in an inpatient admission. That tells us that everything that's gone before has not been as effective as it should have been. So they should have been diagnosed earlier or identified earlier, supported earlier, and a different pathway entirely. I would love it if we could close our inpatient beds. We've set up our inpatient quality, £36 million 3-year task and finish improvement group. It's a mouthful, but we want that vision to be bold and ambitious for what inpatient care, when it is needed, looks like, closer to home, absolutely closer to home, and staff properly trained, and community reaching in to pull people out. We want stomp and stamp to be a reality and words on every clinician's lips whenever they're thinking about the use of medication or appropriate medication. So we have high hopes. The training alone, the last thing I'm going to say is, because you'll hear from me on the panel later, is the training alone isn't enough. The tens and tens of millions of pounds that we're training, but also into learning disability services and services for autistic people this year. 100 million, you know, and more. Crisis alternatives, better inpatient care, earlier identification, key workers for children and young people who may be autistic or neurodiverse. You know, that isn't enough. The training isn't enough. But together, and with high expectations of the ICSs, I do think we can move the dial, increase the length of life, quality of life, and actually I would say the enjoyment and fulfilment of staff working in the services, whether it's primary care, A&E, acute wards or mental health, or wherever they work, because nothing feels better than when you do a good job for the person in front of you. It's what motivates people. So thank you for listening to me. It's about the money, the performance management, accounting, a really big business-like plan and really driving this. But above all, I just want to say it's so good to meet Tom and Paula. I feel really privileged. Thank you. And I nearly clapped.
Thank you so much. That was really good to hear from Claire and Emma. We're really lucky to have Claire in the room. I think earlier we heard this morning, and I think we do need to do more learning between us, because we had a fantastic presentation from Wendy from, I'm going to get the geography on, Suffolk, Ipswich Town, I remember, Ipswich Town, and Northampton, where is Northampton? Way! And they've really cracked it, or on the journey to cracking it, lots of lessons to learn. I think we've got to hear those and we've got to get them out. Maybe you can help Paul get it out there. We heard about primary, you know, doing it differently in primary care. We heard about some of the experience about trainers and supporting them and recruitment. So let's get those messages about how we're making it work and can move that forward. I've met some fantastic people today with lived experience, talked, Claire, particularly about late diagnosis and about long waiting lists and about adults getting diagnosed, and certainly working with people over the last 4 years, I didn't realise there was such a significant elderly population without a diagnosis. So we heard a lot about staff working in old people's services in the community and other settings, and people with no diagnosis and really in very challenging situations because actually nobody knew and understood their needs, and I haven't ever thought about that. We had an ask earlier from one of our experts with lived experience about can we get it into the NHS contract as well, and I know that we're working hard on that with the Department of Health and Social Care, because, you know, it's all, as Claire said, it's passion isn't enough sometimes. You've got to have some levers, you've got to have some clubs to, I think that's a bit violent, isn't it? But you've got to have a way of, you know, getting people to do things, and sometimes just asking people nicely isn't enough. So we're going to look for all the levers that we can do. And the final area that's come up, I think, a few times, more lately, isn't it, Paul, around the justice services, healthcare injustice, and that particularly links to late diagnosis and how we're really letting down a lot of people that end up then in horrific situations that we can't help. So there's a lot of things that I think we can do. So thank you, Claire. It's really great to have you here, and Paul and others, and there's quite a few leaders in the room, so I really do appreciate you giving up your time. So it's 8 minutes past 2. We need to sort the tables out because we're going to move them back across here for our panel question and answer session. So what I'm going to ask you to do is have a conversation on your tables, just for sort of 5-10 minutes, or, you know, go and get a drink or something, but just, is there any more questions that you've now heard from Claire and Paul and Eleanor and Trevor about the code? Is there any other question that you wish you'd made a note of? If there is, do make sure you stick it on the post, and we'll just move the tables across the front so that we can do the question and answer session a bit more central. So that's okay. We'll come back probably in 10 minutes, about 20 past 2. Is that okay? Brilliant. Okay. Well done. Super.
what my name is. I was just taught this. Thank you. You're my. So it's my name is Lauren. Yes. Thank you very much. Okay, so I'm here today to talk about some of the value of having those with lived experience involved. Can we go to the next slide? So a bit about me. So I myself am autistic. So I deliver a lot of training to NHS staff. I also work in the NHS to support those who have ended up in hospital that are autistic and those that have a learning disability as well. So I see a lot of the issues that we are talking about. I see a lot of staff that should know how to support us, but unfortunately don't. And I also see the impact that it has having those with lived experience actually train them. I heard from them every single day, but very often about the impact that has. So I thought what I'd do today is I would, that we're all going to talk about that impact. So first of all, I was one of your trainers through the trials. And I thought I'd reach out to a few other individuals on the next slide to talk about what value the lived experience brings. So the first quote I got from one of you, from Autism Somerset over there, was that having us deliver shows people that we are real, we are relatable. And that is powerful, okay? I'm having conversations with staff all the time where it's a shock to them that we are, sounds kind of strange, but people. They only have experience of supporting us when we are in crisis. So that means they often get a very narrow view of what we're all like. So it's very important that they see us and have us in this training. Yeah? So we give powerful insights from our own personal examples, and this makes training authentic and real. And we've already skipped over to the next slide. Nothing compares to being in the same room as us. Okay, you can watch videos of people sharing their experiences, you can listen to recordings, but this doesn't beat seeing someone in person. Okay, seeing somebody real, okay, being in the same room, being able to hear their emotions and their experiences. Yeah, thank you. And I think also importantly, having us deliver this training, it reduces stigma. I think I heard from you earlier how many staff come forward to say they are themselves or they have family members. That's what I've seen change in just the past few years. So I'm seeing the impact that us being involved has. I'm really seeing that, okay? There is no longer as much shame in coming forward. That is powerful for me, okay? Yes, having us deliver, you can see in our body language, our words and our energy, that goes beyond just the text. Okay, you can have anyone deliver a training package, but having someone that's been there, that knows what it's like, that makes the impact. And every single one of us knows that here. Now, I know also from before, during the trials, before we even started delivering it, this is the kind of messages the NHS staff were giving us about the impact that having us with lived experience has, that they could see our passion. It was powerful, they said. Okay, it was profound. Yeah? All of these things that they said, that impact. Okay, I thought what we could do as one of our last things today was work together to make our own word cloud. Our own word cloud. So what I'm going to do is I'm going to come around the room, and if anybody wants to put their hand up to answer this question for us, Eddie at the back is going to put this into a word cloud. Hi Eddie. And we're also going to type one on the computer, aren't we? So hopefully we've got the question. So the question is, what makes the delivery of this training by those with lived experience so powerful? Okay, we're going to make a little word cloud. So just a very short activity. Does anybody want to go first? Yes? Do we have a microphone, or are you okay speaking?
Lauren?
Yeah? Excellent, thank you very much. You come with us? Amazing. Here you go. Oh yeah, sorry. Can we repeat the question? What makes having those lived experience, lived this training so powerful?
I think it's to do with people who have had that experience in the mental health hospital. For me personally, I've been through the mental health system for about 6-7 years now. And I know bringing that knowledge to the training, knowing that you've got someone to listen to who's been in that situation, who knows how it feels. I do CTR, this stands for Care Treatment Reviews. I do these for people who are in hospital and try and get out. And some of them, some of the CTRs I've done there have been a bit of a shock for me. Like, we've got someone who was don't even need to be in hospital to someone who's now required to use services, and I just feel like it's very, very poor. I do feel like there needs to be more person-centered planning around
genuine and authentic. I think that's the main thing. It's you hear it from the horse's mouth, as it were.
Yeah, absolutely. Thank you. Okay, I'm going to come to you first and then you. Hello there.
Hello, thank you. I think it challenges a hidden unconscious bias.
Yeah, I absolutely. I completely agree with that. We talk about unconscious bias, don't we? So I can hear you next. Right?
I think in simple terms, it's we've been there, we've done that, got the t-shirt.
Yeah, me too. We'll actually have shirts, t-shirts like. Sorry, I'm forgetting the name. Do you remember? Oh, you want to go? Sorry.
Yeah, it helps us to empathize with the real experience.
Yeah. Thank you, Ronnie. Anybody else? Yeah? How are we going to people who are first? Sorry.
Shift the power.
Right, so let's see. I'm going to come to you. There you go.
Equity.
Equity, I love it. Simple, short word. Thank you very much. Okay.
We've got to give the healthcare staff a chance to ask us questions and training, and also we need to learn from the patients in order to understand them.
Absolutely, absolutely. Thank you. Hello there.
Gives them employment.
Yes, absolutely. Thank you. Okay, I'll come over to you. Thank you, everybody. I like this. It's a nice thing to end on. Or there may be one more thing. Sorry, thank you.
It gives people with lived experience a chance to show what, like, kind of, sorry, it shows people that people with lived experience are just more than a label, and there isn't really any training like the Oliver McGowan Mandatory Training out there, and it's very set on changing people's hearts and minds, and
Yeah. It is, yeah. I mean, I started off myself delivering training with others. In fact, a few in the room in my earlier years I was delivering with, and I know part of my journey was finding that empowering and seeing the impact it has on others, and seeing how meaningful this can be.
I think also it's that being brave.
Yes. I think every person with lived experience to come to stand up and to talk about some of the things that are quite traumatizing potentially is incredibly brave. Oh.
My name is Jennifer, I'm here for the Oliver McGowan Training for Disability, and I'm one of those disabilities. Thank you. Disability, and I'm one of those myself. It's interesting listening to people's stories.
Yeah.
Really good.
Yeah.
I don't normally get nervous when everybody.
You did very well.
I really enjoyed it. Thank you.
Thank you. Yeah. Oh, sorry. Just look back to those hands up. That way, the hands up. No. Thank you.
Yeah, so I wanted to say, honest, productive, and deep down inside of every single person here, I know it's to do with passion, and I know earlier, passion is not enough. So I can think of the word that's even stronger than passion, so that as well.
Thank you very much. One thing that I think is great that we are in a room filled with people with the right values as well. Thank you. Anybody else? Yeah? Should we take one more? Yeah? Oh, we've got quite a big word cloud there, haven't we? It's really nice to hear how positive this is and how meaningful it is as well. Oh, Philippa, the perfect person to end on.
Well, there's something about, it's not one word though. It's stopping preconceived ideas. unconscious bias. It's almost conscious bias that people have when somebody they meet has a label and they're expecting something, and then sometimes the professional projects that onto the situation when actually they just need to understand. So it's that stopping people have a preconceived kind of like made up their mind.
Thank you. It is over to you, isn't
It is over to me. I had the last several words. I'll put that down. I should be able to. Oh, this is yours.
That's okay.
It's okay. Okay, so we've got a video. Or do you want to put that up? Do you want to put the word? Or have you done that? It's been. Yeah, I'm done. So we've got a final word from Navina Evans. So Dr. Navina Evans, as many of you will know, she's spoken before at some of our online events. She was the Chief Executive of Health Education England and now is the Chief Workforce Education and Training Officer for NHS England. Now we're all NHS England. So she couldn't be with us today, but she's done us a video to kind of close the day. So if we just listen to her video and then I'll just say a few final words, if that's okay.
Good afternoon. My name is Navina Evans and I'm Chief Workforce Training and Education Officer at NHS England. I hope that you have had a wonderful day celebrating all of the work on implementing the Oliver McGowan Mandatory Training on Learning Disability and Autism. I am in charge of making sure that we have the right number of staff working across the NHS with the right training so they can deliver the best care possible. I'm sorry that I can't be with you in person today, but I really did want to speak with you all, as training our health and care workforce in learning disability and autism is one of my top priorities. Oliver's training, which is the government's approved and recommended training, is a vital part for doing this, which is why all of your work is so very important. Each person working in the NHS should do their best to provide the highest quality care and support. But unfortunately, we know that we don't always get it right. And that's why we need training like Oliver's. Oliver's training is helping to make sure that we learn from the mistakes of our past and move forward with learning. Oliver's training is special because it has been co-produced and co-designed with experts with lived experience. It's really wonderful that many of you are in the room today. You have bravely come forward to make sure we hear your values, needs and concerns. Now, we want everyone's voice to be heard, especially when they receive care and support. This is so, so important. And Oliver's training stands out as one of the best examples of how working together can make such a huge difference. And that is all thanks to you and everyone else who has been on this very long journey. The NHS Long-Term Workforce Plan, which was published recently, sets out how delivering excellent training will help to recruit and keep more staff. But most importantly, it will improve the quality of care and support that the NHS provides. Now, ever since Paula started Oliver's campaign, she's made it her goal to make sure that learning disability and autism are at the heart of staff training across health and care. Now, we can't allow tragedies like Oliver's death and the thousands like his to happen again. This is why the government has made learning disability and autism training a requirement by law. NHS England will continue to support the rollout of Oliver's training across England so that all our staff, but most importantly, the people who need our services, benefit from it. So thank you for coming today. I hope you've enjoyed it. But more than that, thank you for all your hard work, for helping to develop, to roll out, to promote Oliver's training. We couldn't have got to where we are today without your experience of help. Please be very proud. Tell your family, tell your friends what you've been involved in. It is a fantastic achievement.